Good morning, everybody. Allow me to start the lesson one discussion. Under unit one, we will be reviewing the basic concepts or principles of pharmacology. So, under this topic, we will review some of the fundamental definition of terms. We'll also review about branches of pharmacology, focusing more on pharmacodynamics. Under pharmacodynamics, since it talks about drugs effect, we'll discuss the two general ways how the drugs produce its effect. So we have the target protein mediated and those non-protein targeting. So we'll begin with the definition of terms. When I say pharmacology, this is all about drugs. In pharmacology, this covers a lot of aspects, but focusing on the core, all about drugs effects. So that includes ADME, absorption, distribution, metabolism, and excretion. This is being covered by one of the primary branch of pharmacology. That's pharmacokinetics. Under pharmacology, it also studies toxicities of drugs. So this is being covered under toxicology. And then our focus in pharmacology too, all about specific mechanism of action of drugs. This one falls under pharmacodynamics. Okay, so we'll be reviewing all of those branches of pharmacology later on. Now, since the focus of pharmacology is all about drugs, let us also recall how do we define drugs. So there are many definitions about drugs. This could be any agent that has ability to modify or alter the body's structure and function. And by USP definition, drugs could be defined as any article, any agent used in the medication, diagnosis, prevention, treatment, and cure of disease in man or other animals. So somehow you're familiar about this definition. This is reflected in your reference book in DDS. You can scan it over. So that's one of the USP definition of drugs. Now, whenever an agent, a chemical agent, produces an harmful effect, let's say, for example, it causes injury, it causes diseases or even death, then we refer that as a poison. And there are a lot of poison. It could be industrial type of poison. We also have metallic poison. So example, we have arsenic, poisonous metal, arsenic, and lead. So we'll just have a fast-paced discussion under this. Kay definition lang naman siya. Now take note that any drugs could also become poison once it is administered or taken at higher concentration. Upon overdosage of the drug, that could cause harmful effect. Okay. Now, a type of poison that is naturally produced or produced biologically, let's say produced by plants, animals, or bacteria, then that we term it as toxin. So it's a type of poison, but of natural origin. Okay, so a good example is tetrodotoxin. It's a potent poison found in the gonads of pufferfish. There are also plant toxins. Example, di ba, mushroom, it has a toxin. We have what we call orelanin that is produced by a mushroom, a toxin produced by the plant mushroom. Okay, so I will proceed. to the next slide. Now, regarding the branches of pharmacology, I have given emphasis on the two primary branches of pharmacology during our last semester discussion in Pharmacology 1. Those are the dynamics and the kinetics. I also added here in the slide pharmacotherapeutics because I believe in your level, and I also want my student to, diba, develop that skill na you should evaluate or have that skill to easily recommend what is the appropriate drug therapy given to a particular patient. So that is being covered under pharmacotherapeutics. Okay, although the two primary, when I say primary, the main branches under pharmacology is the first two, the pharmacodynamics and pharmacokinetics. So in pharmacodynamics, in operational terms, this is what the drugs do to the body. Okay, so what does the drug uh, do to the body when it is being administered? Of course, it will produce a useful, a beneficial, a clinical effect. So they carry specific mechanism of action. So that's the focus of pharmacodynamics. Under pharmacokinetics, in operational term, we can define that as what the body does to the drug. So you have body to the drugs. In dynamics, you have what the drugs does to the body. So I highlighted here, diba, the letters D and letters K for you to easily recall the operational terms. Okay, so under kinetics, what do the body does to the drug upon taken, administered in the body? Our body will simply absorb that drug. It will distribute it to the systemic circulation. It will metabolize the drug and later on excrete it. Okay, so that is being covered under kinetics. And these two branches of pharmacology, they are interrelated. Okay, so interrelated kasi, of course, the drug once administered in the body will be rendered useless if our body will not participate. So dapat yung body also will contribute, okay, something for that drug to produce an effect. So ADME, that will be the processes that our body will contribute for the drug to function. Okay, kailangan siya ma-absorb sa body, ma-distribute to the active site, metabolize, and of course, excrete. Although there are solid form of drugs that prior to absorption, the active ingredient of that drug in the solid form need to be liberated. You recall that under kinetics? It has to be liberated. It has to be released from that solid form. Okay, example, a tablet. No, before na siya ma-absorb, it has to convert it to its aqueous form, di ba? That's the requirement for a drug to be absorbed. It should be in aqueous form. So that solid form of a drug needs to undergo liberation first. So that's also part of kinetics. There are also drugs that after excretion, they are capable to undergo reabsorption. So pwedeng mangyari yung reabsorption. So there are drugs also. We'll be discussing that. We have a different segment to discuss that. What are those examples of drug that undergo reabsorption? The point here is that's part of kinetics as well. No? So that's why in some other references, kinetics also comprises the following: Ladmer, liberation, absorption, distribution, metabolism, excretion, and reabsorption. Yes, Miss Ignacio, you are raising your hand. Hmm. Or basing natuplukan lang?
Sorry, ma'am, natuplokan, ma'am.
Okay. Sige, no problem. Okay, let's continue. For pharmacotherapeutics, so I have mentioned it earlier, the focus of this study in pharmacology is about rational drug use in the management of diseases. So in here, this covers the drug therapy. What's the management, the intervention that we give to a patient based on its needs, based on the case of the patient. So as pharmacists, you will apply here your knowledge about the rights of medication administration. You recall that in your dispensing, I think you have somehow learned that the different rights of medication administration, wherein as pharmacists, we should make sure that you dispense, no, that we dispense the right medication or the right drug uh, with a right dose. Okay, so with the right dosage or dose to a right patient. So you write it, patient to the right patient, and it should be taken at the right time. Okay, right time, in the right route of administration. Okay, so those are the rights of medication administration. I repeat, as pharmacist, you should make sure to dispense the right drug with the right dose to a right patient at the right time in the right route of administration. Okay, so these are the uh, branches of pharmacology that I would like to give emphasis, although some were already presented to you last semester. But there are other branches also: pharmacology, toxicology, pharmacoeconomics, pharmacoepidemiology, etc. So the rest you can just scan it over in your previous notes. Okay. Now, I have mentioned that I will just be focusing under the review all about pharmacodynamics. So again, in pharmacodynamics, it tells us or it focuses all about mechanism of action of drugs. So let me read. So by definition, the dynamics is all about effects of drugs, the biochemical, the physiological effects of drugs in our living system. Okay. Now, under pharmacodynamics, we will be reviewing the two general ways how the drugs produce their mechanism of action. So there are two general ways. We have drugs uh, that are classified as protein targeting. We also have those drugs that are non-protein targeting. So this will be the outline of topics that I will be reviewing for the introduction part. Okay, and I believe majority of the information under this you have somehow stock knowledge or you have learned this already kay the same halos the same lang no yung slides that I provided now sa akong gihatag pod sa previous semester. Although later I will have supplemental information, additional information, so just bear with me because the additional supplements that I will be giving will also be tackled in our proceeding na mga discussions. All right. So let us begin reviewing about protein targeting drugs. Okay, so we'll begin by defining it. So protein targeting, meaning to say, for a drug to produce an effect, it should bind, excuse me, it should bind to the active site of the protein. Okay, that's why it's protein targeting. Okay, so when we talk about proteins in our body, there are two general classifications. We have the structural proteins, and later I will also present the other one, regulatory proteins. So the flow of our discussion is first I will give examples of proteins and followed by example of drugs that targets that particular protein. Now structural proteins, recall, these are the proteins that maintains the cell shape or the cytoskeleton, the cell's skeleton. That's why it's written there. It forms the cell framework. The structural proteins in the body, this actually composes the structural elements in our connective tissues. Example, in our cartilage, in our bones. Okay? So mainly for the structure, for the cell framework. That's the function of structural proteins. Examples of structural proteins, we have microtubules and tubulin. And recalling their functions in the body, they are involved with mitosis, cell movement, axonal movement of neurotransmitter. All right. Now we have drugs available in the market that could target these structural proteins. Good example are the anti-neoplastics or the anti-cancer agents, vinca alkaloids, and the paclitaxel under the brand name Taxol. They are classified as anti-cancer or anti-neoplastics because of their mechanism of action. Recall they carry anti-microtubule activity. Anti-microtubule or anti-microtubulin activity. Now, why is it? What's the relationship between targeting microtubule to its anti-cancer effect? Let me give an overview. So, ito lang or quick review on the characteristic of a cancer cells. Recall that a cancer cell, they like to divide. They easily proliferate. They rapidly proliferate. And one of the way of our body to divide cells, or one of the cell division mechanism, is what we call mitosis. Okay, and there are structural protein I have mentioned earlier important for mitosis process. Specifically, microtubule participates in this process, in the cell division. I repeat, microtubule, this participates during mitosis. Now, um, of course, uh, to target cancer cells, we could target the cell division process para para mapigilan yung cancer cell proliferation. So we have those drugs that would target microtubule, and they are classified as having anti-cancer activity. So that's the action of vinca alkaloid, vincristine, vinblastin, yan, and paclitaxel. Next, we have colchicine. So this is a commonly encountered drug in your maybe in your previous subject, and I also give an emphasis about this last semester. So colchicine, it's the first line agent for acute gout. Okay, first line in the management of acute gout. And its mechanism of action is also targeting a structural protein. That's why this is written as one of the example here. under protein targeting drug that targets a structural protein. This is the mechanism of action of colchicine. Recalling, it targets a tubulin, and tubulin is a structural protein. Okay, now let's try to relate. How can colchicine, or why colchicine is classified as anti-gout by given its action na it targets tubulin. So recalling, for a patient with or diagnosed with gout, there are two manifestations observed. One is the level of uric acid in the blood is too high. So there is high level of uric acid. Sorry, that's uric acid. High level of uric acid in the blood. That's one manifestation. The other one is the pain. Pain felt by the patient. Now, that pain felt by the patient, the reason why it is unsymmetrical meaning there are different areas being affected. Example, the ankle, the elbow, fingers, wrist. So, unsymmetrical siya. Dili pa siya para sa arthritis. Kung arthritis man yun, kay symmetrical ang pain felt by the patient. So, the rationale behind why unsymmetrical yung pain felt by the patient during gout attacks, it's because of the movement of the inflammatory cells, movement of inflammatory cells. And recalling, uh, I have mentioned structural proteins involved in cell movement. And one of that structural protein, it's the tubulin that contributes to the cell movement of inflammatory cells. And with colchicine, it acts or it targets the structural protein tubulin. Okay, so this will be the target of the drug colchicine. It will depolymerize tubulin. That's why it will be rendered inactive, non-functional. So pipigilan niya yung movement of inflammatory cells. So that's the action of colchicine. It has nothing to do with the uric acid level. And I have mentioned that, di ba? Na with colchicine, wala siyang action towards lowering uric acid. That is why when colchicine is given, prescribed, it is given together with another drug for gout as well, which will target this time uric acid, high uric acid level. Iyahang gina-control ang high uric acid level. So they are usually given together with hypouricemic agent. Good example of hypouricemic agent is allopurinol. Allopurinol. Okay? So take note of that. Colchicine has nothing to do with the uric acid level. It only targets man the tubulin, the cell movement of inflammatory cells. So dapat given siya together also with hypouricemic agent. So it's easy to understand the term hypo, baba, yung uric acid. So pinapababa niya yung uric acid level. Okay? Claro? Give me a thumbs up if you get the information. Sige, let's proceed. Aside from these drugs, there are also antifungal drug that is classified as protein targeting Particularly, they target a structural protein. Ayan. We have griseofulvin. Now, let me erase this portion. Ayan. So, griseofulvin is also classified as a drug targeting structural protein because based on its mechanism of action, it inhibits mitosis as well, although sa fungi, fungal mitosis. But recall, when we talk about mitosis, there are structural proteins involved. Okay, so given this action of griseofulvin, we could tell na it's an example of a drug that targets structural protein. Okay, so those are examples of drugs targeting structural protein. So let's move on the other general type of protein, the regulatory proteins. Now, when we say regulatory proteins, this regulates cell activity or function. Okay, meaning they control the synthesis of cell proteins. Regulatory, they regulate. Now, there are four sub-classification of regulatory proteins. Based on the outline I have presented earlier, there are four. One is the voltage-gated ion channel. And then on the preceding slides, we have carrier molecules, enzymes, and receptors. Okay, so we'll start reviewing on the first regulatory protein. And later, I will give a sample drugs that targets voltage-gated ion channel. Okay, so when you say voltage-gated ion channel, yes, this is a type of a gated ion channel. Before that, regarding gated ion channel, there are actually two types. We have this one, voltage gated ion channel. The other one is the ligand gated ion channel. Uh, both are examples of transport systems. Transport systems meaning it's the mechanism how molecules, how compounds, or particularly how ion, kasi this is an ion channel, how ion passes through the cell or enters or exits the cell. I repeat, voltage gated ion channel, and the other one, the ligand gated ion channel, both are transport systems. Transport systems or mechanisms of how ions enter or exit a cell. And since it is gated, you can analogize it with a gate. No, kanang actual nga gate, 'di ba? Ang gate, it opens and it closes. So the same mechanism, that's how gated ion channel works. It opens and then it closes. For voltage gated ion channel, this gate, this channel transiently opens in response to a voltage. When I say voltage, uh, this tells us about charge, charges. And there are only two types of charge, positive or negative charge, electrical signals. So yung analysis nyo dito is a voltage-gated ion channel opens if it detects changes in the electrical signals. Let's say, for example, I will illustrate an example of a voltage ion channel. Let me extract one, for example, a sodium ion channel. Okay. Now this sodium ion channel will open if it detects too much positive ions outside the cell. Okay, so if there are changes, kumbaga hindi equal, if the charges inside and outside of the cell is not equal, then the gate will open just to attain equilibrium, to attain the balance in the concentration of the charges. Okay? So let's say sodium ion channel, yung specific example given. You all know that sodium ion is technically found outside, outside of the cell. So if, let's say, this is the inside, inside, this one inside, and this one outside of the cell, and here outside of the cell. Technically, sodium ions, they are found outside of the cell. How how do you easily recall that? Piso, the mnemonics piso, sodium out. Okay, so technically, normally, sodium ion are found outside the cell. So when the sodium ion channel opens, what will be the movement of the sodium ion? It will enter. Okay, it will enter the cell. So sodium ions will enter inside the cell. So that's the manner of movement of the ions. So it will depend on their normal location, kung asa sila normally makita. Okay? Let's have another example. Let's say um, not potassium, calcium. Calcium ion channel. So 2 plus. So that's why I write there two positive charges, kasi the ion calcium carries a 2 plus charge. Okay, recalling the mnemonics naman na Miko. Where can we found calcium ion? Normally found inside or out? They are found, yes. They are found outside. Okay, so Miko, calcium out. So when the calcium ion opens, so ma-open siya because na siya na-detect na changes in the electrical signal. So the movement then of the calcium ion is towards towards inside the cell. Okay, so calcium ion will enter inside the cell, which makes the inside of the cell positively charged. Okay, kasi yung pumasok na ion carries positive charge. So may tabo sa inside ng cell positively charged. And that makes the cell depolarized. Diba? Ma-depolarized siya. Or what is the effect? Is it stimulatory or inhibitory effect? If positive yung inside ng cell. What is that? Stimulatory, inhibitory. Yes? Okay. If the cell depolarizes, that is a stimulatory effect. Okay, very good. Stimulatory. So, diba, the effect of the ion channel will actually depend on what ion gets in or what ion exits the cell. Let me give you another example. Let's say potassium. Before I write it, I will ask, potassium ion is normally found where? Inside or outside of the cell? potassium ion. Yes, inside. Use the mnemonics piso. Potassium in. So normally potassium ion are found inside the cell. So once the potassium ion channel, listen, once the potassium ion channel opens, the movement of potassium ions outside the cell. It will go out, it will exit the cell. What will happen to the charge inside the cell? Inside the cell, what will happen? Positive, negative. Nagsilabasan yung mga positive. Yes, very good. It will make the inside of the cell positively charged. Okay? So this is potassium ion channel. So palabas. So making the inside of the cell negatively charged, or that's what we call initially repolarization. Initially. But too much, excessive negative charges inside the cell, that's hyperpolarization. So I will write it later. Another example, in the case of chloride ion channel. Okay? Sige, I will not write the mnemonics, but I believe I have mentioned a mnemonic about the chloride ion. Where can we find chloride ion? Normally, yes, they are found in, yeah, outside. Very good. They are found outside of the cell. Very good. Diba? What's the mnemonics? Fic or ficlo. Okay, so chloride out. Chloride normally found outside the cell. So therefore, once the chloride ion channel opens, then chloride ion will get in, making the inside of the cell negatively charged. Kasi pumasok yung chloride ion, negatively charged yung chloride ion. So again, initially, ang mahitabo, initial repolarization. Kasi bumalik yung negative state. But excessive, dadagdagan ko yung negative charge. That makes the cell hyperpolarized. Okay, dito ko na lang isulat, hyperpolarization. And when you heard about hyperpolarization, that carries or exhibits inhibitory effect. Okay, so inhibitory effect. Okay? So, diba, mag-matter kung unsa ang effect nga i-respond sa ion channel once it opens, depending on what ion gets in or what ion gets out or exits the cell. If negative yung inside ng cell, too much negative, hyperpolarization. If naging positively charged yung inside ng cell, depolarization, stimulatory effect. Okay, so that's it. So that's what the illustration is all about. You have there at resting state of a sodium ion channel, closed pa siya, but na-detect niya too much positive outside ng cell, kaya the sodium ion channel will open. It will cause influx of the sodium ions in the cell. Okay, so that's how voltage-gated ion channel works. And it's an example of a regulatory protein. It's a transport system. What molecules are being transported kapag gated channel? Mga ions. Ions. Okay, so we have, since I have mentioned about ions, so you can just review this. Kindly add as well, although they are not available as voltage gated ion channel, yung Suli Bio na mnemonics. Just to recall na these are also ions. Ions present in the cellular fluid. Anion in particular. You remember? Sulibio, sulfate in, bicarbonate out. The second major extracellular anion. Okay, then these are just for your information as well. Sodium ion and chloride ion, important for tonicity. The calcium ion for structure, these are structural components of bones, important for muscular contraction, for the release of neurotransmitter. You recall sa synapse, in the pre-synapse, there are vesicles. For the vesicles to release neurotransmitter, there should be a calcium ion that should penetrate in the presynaptic membrane that will trigger release of neurotransmitter or exocytosis of neurotransmitter. Magnesium ion is a natural calcium ion channel blocker. So these are just part of review. But we have this were given emphasis, let's say in your inorganic chemistry, diba, we have learned the different chemistries of ions, of elements. Okay. Sige, I will move on this next slide. Now, aside from sodium ion channel, we have other ion channels. So those were illustrated earlier, potassium ion channel, calcium ion channel. Okay. Now, there are drugs as well that inhibits those ion channel. For example, a drug or group of drugs that blocks sodium ion channel, they are known as sodium channel blockers. Example are the local anesthetics, those ending in cane. This is further classified into two based on chemistry. So we have the ester type and then the amide type. To easily identify if it is ester or amide type based on their name, you can check on the number of letter I. Okay. So most of the names of local anesthetics that falls under ester type, it has only one letter I, whereas amide type, most of them has two letter I. So I will give an example. Benzocaine. So you have one letter I. And then for amide type, palatandaan lang ni siya ha, lidocaine. Okay? Usually this is marketed, available in the market under the brand name Silocaine. Okay? Next, another example that targets sodium ion channel are the anticonvulsants. We have carbamazepines and phenytoin. And when we discussed about drugs for arrhythmia, we'll tackle this, the anti-arrhythmics. For now, just know that its action is inhibiting sodium ion channel. So the class 1 anti-arrhythmics, particularly the 1A, 1B, and 1C, they block sodium ion channel. Examples of drugs that targets potassium ion channel, we have the anti-arrhythmics also, but the class 3. Class 3 anti-arrhythmics, a good example is amiodarone. Again, we'll have a separate segment wherein I will thoroughly discuss all about anti-arrhythmics. That's part of cardiovascular drugs. Okay, so just know for now na example sila sa protein targeting drugs. They target this voltage-gated ion channel. Another example, insulin secretagogues. These are anti-diabetics. anti-diabetic. So we will also tackle all about the different anti-diabetic agents under endocrine system, drugs that targets endocrine system. Okay, so example of insulin secretagogues are those sulfonylureas, those with a prefix gly with letter I or gly with letter Y. Okay, so example, glimepiride. Ayan. Another example, glyburide, glipizide, um, glibenclamide. So those are examples of sulfonylureas. So potassium channel blockers sila. And then lastly, we have drugs that targets calcium ion channel. So sila yung mga CCBs, calcium channel blockers. This is subclassified into two based on chemistry. Based on their structure, there are dihydropyridines and those that are non-dihydropyridines. Those with dihydropyridine structure, their names ends with dipine. Very good. Example, amlodipine. Let me write example, few example. Amlodipine, nifedipine. Nifedipine, as long as ending in dipine. Nicardipine. Okay, and the other dipines, those are CCBs. So if you encounter questions and you are asked to identify if protein targeting ba sila, so just do not forget the um their suffixes. No suffixes kapag ending in dipines, ending in cane, with a prefix gly, those are protein targeting. They target voltage gated ion channel. And then we have non-dihydropyridine, still ACCB, a calcium channel blocker. There are two main example here, verapamil and diltiazem. Okay, majority of the listed class of drugs will be discussed on our proceeding topics under cardiovascular drugs, under endocrine systems. The first two general classes, no, kani mga classes of drugs, the anticonvulsants, local anesthetics, these were part under pharmacology 1. I have provided you a handouts about anticonvulsant agent, about anesthetic agent. So you can just scan it over your notes if you wanted to read more about this. But the rest of the classes of drugs, nasa baba, this will be discussed later on. It's part of pharmacology too. Okay? So that's all about voltage-gated ion channel and the drugs that targets them. Okay, let's proceed. Um, After voltage-gated ion channel, another regulatory protein, we have carrier molecule. It's a cell membrane protein with specific binding sites and undergo conformational changes. So example, excuse me, we have the sodium ion, potassium ion ATPase pump, or the sodium potassium ATPase pump. Okay, the function of this exchanger is for extrusion of calcium ion from cardiac myocyte. So when say extrusion, it um, releases, no? So yung movement ng calcium ion is outside the cell, outside the cardiac myocyte. Okay, so let me give you an overview, or let's say an illustration how this pump function. Although we'll get to know more about this when we discuss all about heart failure drugs, okay, or drugs for heart failure. So I will still give emphasis on this here sa introduction part. Okay, let me draw an illustration of a cell membrane because it's a cell membrane protein. So let's say this is the cell membrane, and then embedded here is on this portion. Let me label, this is the sodium potassium ATPase pump. Now, please take note that this pump works along with another exchanger. Okay, so you on the, kumbaga, linked siya. Together with it, coupled with it is another exchanger. Okay, and that is what we call the NCX, or that is also sodium calcium exchanger. So that is abbreviated as NCX. So I repeat, the sodium ion potassium ATPase pump functions together with NCX. So how would be this pump, or how would be the movement of the ions in sodium potassium ATPase pump? So this what happens. In every potassium ion, two potassium ion that gets in, three sodium ions gets out. So kumbaga ang ratio niya is 2:3. Okay? Now, you might be confused, ma'am, ganina lagi ang movement sa sodium ion is pasulod. Ang movement sa potassium ion dapat is outside. You might be confused. We are done with voltage-gated ion channel. Sodium potassium ATPase pump is not a voltage-gated ion channel. It's a carrier molecule. Okay? So this is how the movement, no, of the ions once they exchange in the cell for sodium potassium ATPase pump. Katong ganina, katong movement normally sa piso, miko, ficlo, that applies for an ion channel. Okay, sa ion channel to siya applies. Okay? Now, why is it dili equal ang ratio sa potassium and sodium ion nga pag-exchange upon exchanging? Okay? Now, yung sobrang isa, yung extrang sodium ion, babalik inside the cardiac myocyte. Okay? Inside the cell. By the way, the cell that I am illustrating here, for instance, is the cardiac muscle, the cell of the in the heart, okay, in the muscle cells or the muscle cells. Okay? So yung extrang isang sodium papasok, babalik. Again, yung isang sodium ion, it will enter via NCX. Okay, via sodium calcium exchanger. Once sodium ion, one of the sodium ion gets in, a calcium ion will get out the cell. Okay? So NCX exchanger. So mag-exchange lang sila, papasok yung sodium, lalabas ang calcium. So that's how sodium potassium ATPase pump works. So as a result, what happens? Where can you see calcium ion? In the end, naa siya sa outside of the cell. Okay, diri man ang inside, outside of the cell. You can observe here that calcium ion has been extruded, no, from the cardiac myocyte. Okay? Now, there are conditions, health conditions, wherein this function of sodium potassium ATPase is not good. For example, a patient with heart failure. Okay? Patient with heart failure. Failing naman iyahang heart magpump, musamot if ang mga calcium ion nagsisilabasan. Remember, calcium ion is important for contraction, muscular contraction. Cardiac myocyte is an example of a muscle. Okay, di ba? Myo means muscle. Okay? So, there are drugs that would target, inhibit this pump, and they are classified as anti-heart failure drugs. Okay? So, I hope you got my point. Again, if the patient has heart failure, this is not good. No, this function of sodium potassium ATP should be controlled kasi nagsisilabasan yung calcium ion. And importante nga atong i-accumulate ang calcium inside the cardiac myocyte for contraction to add strength sa contraction of the heart muscle. Okay? So, example of a drug that inhibits, targets this sodium potassium ATPase pump are the cardiac glycoside digoxin. I know you're familiar with cardiac glycoside. You have that, diba, in your pharmacognosy or the digitalis. Okay? These are cardiac glycoside and their action is inhibiting sodium potassium ATPase pump. Now, if we inhibit sodium potassium ATPase pump, so no exchange of potassium and sodium ion, therefore walang papasok na sodium ion, walang lalabas na calcium ion. Okay? With that, we can accumulate calcium ion inside the cell. Kasi hindi man mailalabas yung calcium ion. Okay? So, ma-accumulate inside the cell ang calcium ion, and that would help increasing the muscular contraction. Inotropic yung effect. You remember the term inotropy? Inotropy, it's a medical term, di ba? It tells us about the strength of the heart's contraction. So it has inotropic effect because it will cause accumulation of calcium ion inside the cell. Calcium, importante for muscular contraction. So that's it. That's the function of the digoxin. It's an example of a drug that targets a carrier molecule, the sodium potassium ATPase pump. Okay. So we'll get to understand more about that carrier molecule as we discussed heart failure drugs later on. Okay? Sige, thumbs up if you understand about digoxin's function. Okay, good. Let us proceed with carrier molecules na other example, proton pump. This one, you have learned about this. The proton pump or the potassium ion hydrogen ion pump. This is important to mediate release of acetylcholine, gastrin, and histamine. Recalling, these three endogenous substances, they influence HCl secretion, and of course, there are health conditions, patients na they have higher level already of acids in their stomach. That's why we have to manage or control the HCl secretion via inhibiting proton pump. Example, in the case of patients that who are hyperacidic who have ulcers, peptic ulcer diseases, with, let's say, GERD, gastroesophageal reflux, kana sila. So, kailangan i-inhibit ang proton pump because this mediates release of these compounds that would cause increase HCl secretion. Okay, so we have drugs that could target a proton pump, and those are the inhibitors of proton pump. Recall, you can identify PPIs based on the name, the suffix niya, prazole, except aripiprazole. Why? What's the classification of aripiprazole? Yes, very good. It's an antipsychotic. Okay, antipsychotic. It's a dopamine 2 blocker. Okay, so it has nothing to do with this proton pump. Excuse me. So just take note of that. All the prazoles except aripiprazole are PPIs. Okay, so they are most efficacious for hyperacidity based on the mechanism of action. It reflects ayahang MOA. Kasi hindi lang histamine yung ini-inhibit niya, lahat ng endogenous compounds that increases HCl secretion. So if you are to compare between a PPI, example OMEP, yung OMEP or omeprazole versus an H2 blocker, ranitidine, then we could tell most efficacious yung mga PPI because they inhibit the following. They inhibit acetylcholine, gastrin, and histamine release. Whereas, if it's an H2 blocker lang, histamine lang ang gina-inhibit. And there are still other endogenous substances that could trigger release of HCl. We have gastrin and acetylcholine. Okay? Omeprazoles, esomeprazoles, pantoprazoles, those are examples of PPI. Ranitidine, what else? Famotidine. Present in Kreml S, the blue one, Kreml S plus. Diba? Present yung famotidine, so it has an H2 blocker. Na cimetidine, nizatidine, those are examples of H2 blocker. Okay? H2 blocker ranitidine, this is not, it does not target a carrier molecule. Do you agree? H2 blocker man siya. So, unsa nga regulatory protein iyahang gina-target? There are 4 regulatory protein, voltage-gated, carrier molecule, enzyme, receptor. So, asa man ang gina-target sa H2 blocker? Not a carrier molecule, of course. Now, based sa pangalan, histamine 2 blocker. Yes, very good. Histamine 2, um, uh, it's a receptor. It's a subtype of a histamine receptor. Diba? Naalala? So, ranitidine, basing ma-confuse mo kay diri na ko siya gisulat nga slide. Okay? So, ranitidine, famotidine, mga H2 blocker, they target receptors. Because histamine 2 is a receptor. Omeprazole targets proton pump. So, it targets a carrier molecule because a proton pump is a carrier molecule. Okay, so again, let's proceed. We're done with the first 2 regulatory proteins and I have provided examples that targets those regulatory protein. Let's proceed with the third. Third type of regulatory protein are the enzymes. So by definition, we define it as a biological catalyst. So they facilitate chemical reaction. So these are examples of enzyme: phospholipase A2, cyclooxygenase, 5-lipooxygenase. These 3, they are involved in the arachidonic acid pathway, particularly in the production. This one, ang PLA2 for the production of arachidonic acid via converting phospholipids to arachidonic acid. And then the COX and the LOX They are involved in the metabolism of this fatty acid, arachidonic acid. It's a fatty acid because it came from, di ba, yung major source is a lipid, a hydrolyzable lipid, and the product of a hydrolyzable lipid is a fatty acid. Okay? So there are two pathways na pwede niyang daanan, the COX pathway and then the 5-LOX pathway. So arachidonic acid, when metabolized with COX, it will produce a cosanoid prostaglandin. And there are other um, products, no, or metabolites na ma-produce under COX pathway. We have prostacyclin as well. Let me write it. Prostacyclin, cyclin, thromboxane, yes, TXA2. No? So those are examples of metabolites that may be produced under COX pathway from arachidonic acid. And then under 5-LOX pathway, leukotriene is produced. For leukotriene, its function, its effect is bronchoconstriction. Now, I will only highlight or give emphasis about prostaglandin. Okay? So, there are many types, no, of prostaglandin. There are prostaglandins important for normal cell activity. Example, they function for cytoprotection. When you say cytoprotection, it is important for to thicken the lining of the stomach. So it protects the stomach against HCl. So it thickens lining of stomach. Okay. So it's a protection against HCl. So this is a one of the function of prostaglandin important for cell activity, for the normal cell activity. However, there are also prostaglandins that are produced in the setting of pain or inflammation. And there are pain and inflammation that is not tolerable, especially if it's excessive, and then the duration of pain and inflammation, it lasts longer. So kailangan na nato og drugs, no, that to relieve pain and inflammation. So one of the example of class of drugs with anti-inflammatory effect are the NSAIDs. NSAIDs targets or inhibits the enzyme cyclooxygenase. So you have there in the illustration the NSAID, it inhibits COX. Therefore, inhibiting inflammation. That's why nakalagay it has anti-inflammatory effect. However, ang consequence with this drug is it also inhibits the production of those prostaglandins important for cytoprotection. Okay, that's why there is a possibility na when NSAID is taken in an empty stomach, there is a possibility of uh, acquiring, or it could induce, kumbaga, a disease ulcer. So we have what we call NSAID induced ulcer. Okay, and there are cases already na ang ulcer is caused by a drug, caused by, let's say, NSAID. Okay, the reason again why, with the action of NSAID inhibiting COX, na-inhibit din yung mga prostaglandin important for cytoprotection. This usually happens, ma-induce lang ang ulcer caused by NSAID if you take NSAID on an empty stomach. That's why, as a remedy, um, patient counseling determining that taken after, this should be taken after meals. Okay, so that's it. So that's what, those are example of drugs that targets COX, an enzyme, NSAID. We also have drugs that targets 5-lipoxygenase kasi there are conditions, health conditions na production of leukotrienes could worsen conditions related to respiratory na system. Example, kapag may asthma, no, ang patient. If the patient is asthmatic and then hindi kontrolado yung leukotriene level, then 'di ba, it has an effect bronchoconstriction. So it could worsen the asthma nga condition sa patient. So we have drugs. We have drugs that could target 5-LOX, and that's Zileuton. Okay? It inhibits lipooxygenase para inhibited yung production ng leukotriene. So maiiwasan yung bronchoconstriction. So it has anti-asthma activity. We also have drugs, although it does not target the enzyme itself, the enzyme 5-LOX, but it targets the leukotriene receptor. Okay? Kasi for the leukotriene to render an effect ng bronchoconstriction, it should bind to a particular receptor, and that is known as leukotriene receptor. Okay? So dapat mo bind siya sa leukotriene receptor. Now we have drugs that also targets LT receptor or leukotriene receptor. Are you familiar with montelukast? Okay, 'di ba montelukast is classified as anti-asthma also nga drug. So yung action niya, it's not inhibiting the 5-LOX, the enzyme, but it blocks the receptor kung saan nagbabind yung leukotriene. So that's the action of montelukast. Yes, it's a leukotriene antagonist receptor. Very good. Okay. And then for phospholipase A2, we have drugs that could inhibit or block that. Steroids. You're familiar with steroids. Example, prednisone, that is classified as a steroid. And steroids usually exhibits anti-inflammatory, anti-asthma nga activity, and it reflects based on this pathway. Kapag na-inhibit natin yung phospholipase A2, syempre wala ng arachidonic acid, so no more inflammation, no more bronchoconstriction. So yung lahat ng nasa baba na pathway, it will be rendered inactive. Kasi yung nasa taas na ininhibit ni steroids. Okay, that's why nasa anti-asthma and anti-inflammation activity. Okay, so those are examples of drugs that targets enzymes, these enzymes, phospholipase A2, COX, and 5-LOX. Okay. For the next slide, it also tells us about an example of an enzyme, monoamine oxidase. You have encountered this when we discuss about antidepressants na mention doon, monoamine oxidase. It's an enzyme and it has two subtypes, the MAO-A and the MAO-B. Recall that MAO-A is responsible for metabolism of the following: norepinephrine, epinephrine, serotonin, histamine, and also tyramine. Okay? And then MAO-B, this is responsible for metabolism of dopamine. Okay. Now, when we talk about metabolism, please take note, it's all about lowering or the activation of a particular compound, okay, or ligand, or um, substance, no, or neurotransmitter. So, depende na siya what is being metabolized. So, that's the general concept of metabolism. Although there are some drugs wherein, particularly the prodrugs, it does not apply here, no, nga kapag prodrugs ni undergo metabolism, ma-deactivate yung drug. Okay, so that's an exception. Kasi we have that prodrugs na they really require metabolism to activate, to release their active form. Okay? But general, I'm talking about the general nga concept about metabolism. It's about inactivation, lowering of a particular substance. Okay, so please take note of that. Now, the functions of these enzymes uh, are not good in some patients, particularly those patients with, for instance, Parkinson's disease. Because patients with Parkinson's disease, the underlying cause of the symptoms why they acquire symptoms related to involuntary muscle movements, it's because sobrang baba ang dopamine levels. And with MAO-B, with the function of MAO-B enzyme, it would worsen na musamot lower ang level ni dopamine, no? If not controlled yung enzyme MAO-B. Okay, that's why we have anti-Parkinson's drug, di ba? Wherein they block dopamine receptors. Okay? And we also have anti-Parkinson's disease na yung action nila is via inhibiting the enzyme MAO-B. Okay? So I hope you got it. There are also conditions na not good yung function ng MAO-A, okay? Because, for instance, during depression, okay? For a patient with depression, the problem is low level of serotonin. Low level of serotonin. Now with MAO-A, going back to the action of MAO-A, it causes metabolism, meaning lowering. Tama? Metabolism of serotonin. So musamot. Kung ang patient na depression, hindi kontrolado yung MAO-A, then musamot low level serotonin. That's why these enzymes needs to be inhibited. So we have the following drugs that could inhibit monoamine oxidase, and there are two general types based on selectivity. We have the non-selective and then the selective. Non-selective MAO-Is, they could inhibit both subtype MAO-A and MAO-B. Examples, tranylcypromine, isocarboxazid, and phenelzine. Selective MAO-A, we have that. MAO-A inhibitor. It only inhibits MAO-A. Okay? Moclobemide. And then we also have selective MAO-B inhibitor, selegiline. If I were to ask you, between moclobemide and selegiline, which do you think offers clinical or beneficial effect to patient with depression, moclobemide or selegiline? Yes, it's moclobemide. Very good, because it is these drug that targets a MAO-A. Going back to the problem in depression, it's about the level of serotonin. Too low yung level ng serotonin. Okay, so you inhibit here the subtype of MAO, a subtype of monoamine oxidase that metabolizes serotonin. Okay, so that's MAO-A. Therefore, selegiline has nothing to do with depression, right? Ang selegiline, wala siya'y beneficial effect sa depression kasi ang MAO-B, it has something to do only with dopamine. While the problem in depression is about serotonin level. Okay? So, para asa man si selegiline, Parkinson's. Okay, very good. It's an anti-Parkinson's drug. True or false? True or false? Phenelzine could offer clinical effect to patients with Parkinson's and depression. True or false? True. Very good. Because it's a non-selective MAO-I, meaning it can inhibit both subtypes. Meron siyang activity inhibiting MAO-A, meron din siyang activity inhibiting MAO-B. Okay? Very good. So far, in our discussion, we were able to finish the first three classes of regulatory proteins and examples of drugs that targets these proteins. So, for the interest of time, I will just finish the discussion until this slide. Okay, so all about receptors, we'll discuss that next meeting. Okay? So, para na ay continuity, dili putol ang discussion about receptors. Okay? Do you have any question?